participants, greetings of the day. Today we will discuss counseling for personal growth and adjustment, and in this unit we will take up the area theory of counseling. We will discuss the psychoanalytical theory given by Sigmund Freud. Sigmund Freud was an Australian neurologist, psychologist and the founder of psychoanalysis, a clinical method for testing psychopathology through dialogue between a patient and a psychoanalyst. Freud's view of human nature is considered to be a very dynamic, meaning that there is an exchange of energy and transformation. Freud used the term catharsis to describe this release of this energy. Freud saw the personality as composed of a conscious mind, a pre-conscious mind and an unconscious mind. The conscious mind has known knowledge of what is happening in the present. The pre-conscious mind contains information from both the unconscious and conscious mind. The unconscious mind contains hidden or forgotten memories or experiences. He defined the structure of personality in a very effective manner. He said that the personality has three parts. The first is id, the ego and the superego. We'll take up one by one. The id is present at birth and is a part of unconscious. The id is the site of the pleasure principle, the tendency of an individual to move towards pleasure and away from pain. The id does not have a sense of right or wrong, is impulsive and is not rational. It contains the most basics of human instinct, drives and genetic endowments. The ego is the second system to develop and it functions primarily in the conscious mind and in the pre-conscious mind. It serves as a moderator between it and the superego, controlling wishes and desires. The ego is the site of the reality principle, the ability to interact with the outside world with appropriate goals and activities. The superego sets the ideal standards and morals for the individual. The superego operates on the moral principles which rewards the individual for following parental and societal dictates. Guilt is product produced when a person violates the ideal ego, dying or ignoring the rules of the superego. Reviewing these theories used in counseling, Patterson and Watkins in the year 1999 suggested that modern approaches can be arranged on a continuum ranking from non-directive approach to directive approach. Continuum of counseling theories, which has been given in 1996. There are 5 developmental stages needs to discuss. The first is oral stage. Oral stage is centered on the mouth as a source of pleasure. The second is anal stage. Anal stage is centered on the anus and elimination as a source of pleasure. And the third is phallic stage. Phallic stage is centered on the genital and sexual identification as a source of pleasure. And latency stage, it is a stage time of little sexual interest in Freud's developmental view. This stage is characterized with peer activities, academic and social learning and development of physical skills. Genital stage begins with the onset of puberty. If the other stages have been successfully negotiated, the young person will take an interest in establishing sexual relationship. We will discuss what is defense mechanism. When a person experiences anxiety, he or she will seek for a solution that is often in the form of ineffective behavior or embarrassing actions. In order to reduce anxiety, the person may unconsciously react in a defensive way to reduce stress. Such defensive ways of coping with anxiety is called defense mechanism. We have an ego defense mechanism also, where believed by Freud to protect the individual from being unwhelmed by anxiety. He considered them normal and operating on the unconscious level. Some of the ones most often referred are to repressive is the defense mechanism, whereby the ego includes any painful or undesirable thoughts, memories, feelings or impulses from the conscious. Projection is the defense mechanism, whereby the individual assign their own undesirable emotions and characteristics to other individuals. We have reaction formation is the defense mechanism, whereby the individual expresses the opposite emotions, feelings or impulse than that which cause anxiety. Displacement or defense mechanism, whereby the energy that is generated towards a potential dangerous or inappropriate target is reinforced to a safe target. Sublimation is a positive displacement which is called whereby the frustrating target is replaced with a positive target. Regression is the defense mechanism whereby return to an earlier stage of development. We have rationalization is the defense mechanism in which an individual creates a sensible explanation for an illogical or unexpected behavior, making it appear sensible or acceptable. Denial is a mechanism whereby an individual does not acknowledge an event or situation that may be unpleasant or traumatic. Identification is a defense mechanism whereby a person takes on the qualities of other person to reduce the fear and anxiety towards the person. Here comes the role of counselor. Role of counselor is to encourage the development of transference, giving the client a sense of safety and acceptance. The client freely explore difficult material and experiences from their past, gaining insight, the working through unresolved issues. The counselor is an expert who interprets from the client. The psychoanalytic counselor acts as an expert who aims to find the underlying roots of the client's current problem. The counselor encourages clients to talk about whatever comes to mind, especially their childhood experiences. In order to make the client feel comfortable, the counselor sits slightly out of the client's view while the client lies down comfortably on a couch. Taking freely about an issue often leads to the recall to relate thoughts or emotions. This technique of free association together with dream analysis and gaining insights enable the counselor to understand the client's motive and interprets his or her unconscious thoughts and wishes. The goal of psychoanalytic counseling is to help clients become aware of their unconscious thought and emotions that have affected their behavior or action. The counselor may also help the client identify unresolved developmental issues, either personality or psychosexual aspect, so that clients can continue with their development in a healthy way. In addition, through counseling, clients will also be able to recognize ineffective ways of coping with stress they had previously adopted. The counselor can teach clients how to cope positively with the anxiety and the demands of living. We have goals of therapy which includes helping the client bring into the conscious and unconscious, helping the client work through a developmental stages that was not resolved or where the client comes fixed, help the client adjustment to the demand of the work intimacy and the society. Here we have some techniques of counseling which is described as a tool to help clients work out of their problem. The first is free association is a process where the client verbalizes any thoughts that may without censorship, no matter how trivial the thoughts or feelings may be to the client. We have a dream analysis. Dream analysis is a process where the client relates their dreams to the counselor. The counselor interprets the obvious or manifests content and the hidden meaning or latent content. We have analysis of transference. Analysis of transference is a process where the client is encouraged to attribute to counselor those issues that have caused difficulties with significant authority figure in their lives. The counselor helps the client to gain insight by the conflicts and feelings expressed. We have analysis of resistance. Analysis of resistance is a process where the counselor helps the client to gain insight into what causes from the basis of a hesitation or halting of the therapy. Interpretation is another process where the counselor helps the client to gain insight into the past and present events. Here are some interventions. Intervention psychoanalytic counseling theory is one of the most well-known treatment modalities, but it is also one of the most misunderstood by mental health consumers. This type of counseling is based upon the theories and work of Sigmund Freud, who founded the school of psychology known as psychoanalysis. Psychoanalytic counseling theory looks at how the unconscious mind influences thoughts and behavior. Psychoanalysis frequently involves looking at early childhood experiences in order to discover how these events might have shaped the individual and how they contribute to the current actions. People undergoing psychoanalytical therapy or counseling often meet with their therapist at least once a week and may remain in counseling therapy for a number of weeks, months, or years. Psychoanalytic theory grew out of the work of the famous psychoanalyst Sigmund Freud, who began developing these therapeutic techniques in the late 1800s. In 1885, Freud began to study and work with Jean-Martin Charcot in Paris. Charcot used hypnosis to treat women suffering from what was then known as hysteria. Symptoms of the illness includes partial paralysis, hallucination, and nervousness. Freud continued to research hypnotism in treatment, but his work and friendship with colleagues Joseph Brunner led to the development of his most famous therapeutic techniques. Breuer described his treatment of a young woman known in the case history as Anna O, whose symptoms of hysteria were relieved by taking about her romantic experiences. Breuer described his treatment of a young woman known in the case history as Anna O, whose symptoms of hysteria were revealed by talking about her traumatic experiences. Freud and Breuer collaborated on a book called Studies on Hysteria, and Freud continued to develop his use of this talk therapy. Psychoanalytic therapists or counselors generally spend time listening to patients talk about their lives, which is why this method is often referred to as a talk therapy or talk counseling. The counseling theory provider will look for the patterns or significant events that may play a role in the client's current difficulties. Psychoanalyst believes that childhood events and unconscious feelings, thoughts and motivations play a role in mental illness and maladaptive behavior. Psychoanalytic counseling theories make also make use of other techniques including free association, role play and dream interpretation. While this type of counseling theory has many critics who claims that psychoanalytic theory is too time consuming, expensive and generally ineffective. This treatment has several benefits as well. The counselor offers an empathetic and non-judgmental environment where the client can feel safe in relieving feelings or actions that have led to stress or tension in his or her life. Oftentimes, simply sharing these burdens with another person can have a beneficial influences. Freud defined psychoanalysis as the science of the unconscious soul and the psychology of unconscious, which evolves according to the advances of the psychoanalysis. Via the vocal etiology of neurotic symptoms, he discovered that the dream was similarly constructed and that the unconscious becomes the generic psychic system. It contains vicious, unconscious and undestructible and the repressed, gathered by the libido through free energy and regulated by the pleasure principle. The primary processes which comes displacement and condensation preside over the unconscious. The conflict between repressed instinctual motion and censoring force creates the dream. The paradigmatic compromise formation. If we look at unconscious wishes reduced to their most fundamental and truest shape, we shall have to conclude, no doubt, that physical reality is a particular form of existence, not to be confused with the material reality. The reality of unconscious reveals itself in other localized processes such as joking, in the forgetting of words and others symptomatic activities. At the end, we can say that psychoanalytic theory is the theory of personality organization and the dynamics of personality development that guides psychoanalysis, a clinical method for treating psychopathology. And thank you very much. Do take very good care of yourself.